Thank you all for joining us. Welcome to BPM's Return to the Office and Remote Management Strategies webinar. My name is Jill Pappenheimer, and I'm joined by Nancy DuBois. We are both leading our HR consulting group at BPM. I have been in HR a long time, a little over 30 years. Makes me tired every time I say that. I'm a partner here at BPM, and we help companies from small to large in their HR function. And that can take many different shapes and forms, and does take many shapes and forms. We can be a complete outsource for organizations, or support certain projects or needs, or return to work plans during this pandemic. Who would have thought we would have a need to focus on strategies around a pandemic? But we are doing a lot of advisory during this time. We can do comp projects. We do a lot of HR systems projects. And so it's really about how to help create a people function that's powerful, that's meaningful, that's supporting the organization in a way that makes sense for that organization. Nancy, would you like to introduce yourself?
I would love to introduce myself. Hi, everybody. My name is Nancy DuBois, and I'm the Managing Director of the HR Consulting Group at BPM. I'm responsible for overseeing a group of 16 HR consultants, and all of us have worked remotely for a very long time. We've never actually had an office where we've all been in. So we have a lot of experience managing remote teams, and we're helping a lot of clients with that process, especially managing now in times of COVID. And I just wanted to say that I appreciate you all coming on the webinar today with so much going on in the world. And I know it's sort of hard to focus on some of these things, but we appreciate it. And we're all here and can support each other through just being together and, learning things as we go along and trying to help each other in the world. So thank you for joining us today.
We're going to be going through, as you can see from this slide, the people perspective first, and then considerations when returning to work. So we've been supporting clients in this transition during this pandemic, and how best to prepare for employees going back to the office, what to do with in scenarios. We're going to talk about different scenarios for when employees get exposed to COVID, what to do then, how to support the rest of the staff. We'll talk about what if somebody has symptoms, what if they test positive. So different scenarios on how to actually play those out and support your staff, because preventative measures are key. Being proactive is key here. And so we'll spend a fair amount of time in those areas, as well as talking about management. So I will end the tail end of the webinar talking about how best to support people and manage staff during this time. What are best approaches that might help you in terms of responding as an organization and also responding to individuals. So to start us off, always want to talk about people first. So knowing that employees are experiencing fear, loneliness, anxiety, sadness, stress, they might be having trouble sleeping. They may be feeling afraid when they go out. They may have just come back from the store and had concerns. And when you talk to them, so really tuning into what people are dealing with. Many of us have children at home, or are taking care of elderly parents, or being concerned about elderly parents. There's so many different scenarios where there's added stress in our lives. And I think because this pandemic is not going away tomorrow, we as employers need to think in terms of honoring people in ways where we maybe never thought of before. And so what does that mean? Maybe it means a shift in identifying values for the organization, Maybe it means doing some kind of supportive engagement around social justice as a company. It can play out in various ways, but really honoring people is so key right now. One way that we have played that out at BPM is that, at least with Nancy and I, with our team, is we always do connection before content. Every time we start a meeting, we allow people to have an opportunity to talk about how they're feeling, what's on their mind. Maybe we ask a certain question to get everybody sort of loosened up before we start the content of the meeting. And so it's always that opportunity to connect personally. And I think that level of interaction may be here to stay, my own personal projection, but I think that individual connection, that personal connection, is going to be tied into our work lives for some time to come. Another key thing to keep in mind is to encourage, as employers, the healthy aspect. So staying physically and mentally healthy, as much as you can do from an employer standpoint, is recommended. So exercise, maybe send to all of your employees opportunities for them to get exercise online through various sites. To maybe take a 5-10 minute break during a meeting and encourage people to jump up and down or wander around and get their blood flowing. Because I'm sure a lot of you who are sitting there watching this right now are feeling a little antsy. 2 o'clock in the afternoon, time to move. So maybe just remind people to do that. One area we're going to talk about a little later is workers' comp. There's certainly that fear of people getting sick and how that affects you as an employer, and what does that mean for workers' comp. So, anything you can do to avoid those kind of health issues that can affect the organization, but also individuals. And then expanded EAP. Hopefully you all have heard of Employee Assistant Program, which can be and may be offered through your insurance health plan. You may currently have that. Make sure you are promoting that for employees as a way for them to connect with online therapists to talk about any mental health issues or concerns they may have. And so you want to promote that kind of opportunity for employees. If you don't have an EAP program currently or something similar, you can add that, even though it might not be included and may not be part of your open enrollment and included in your plan. So I would encourage you look into that, check in with your insurance broker. And additionally, just connecting with people more often is recommended in terms of touch calls. Maybe do weekly touch calls with your staff, with your direct reports. Encourage managers to do that with their direct reports, so that we're at least regularly checking in with people and having that opportunity to have connection before content. So from a personal standpoint as well as a work standpoint, especially when people are working remotely. And to keep in mind the importance of the visual connectedness. So every time I talk to a client or a potential client, I'm encouraging that connectedness, because it's a huge differentiator, and seeing that nuance of those facial expressions. At the same time, we want our staff to have that connectiveness when they're isolated and maybe feeling alone, especially if they don't have family around. So give them that opportunity. Certainly, we have to also honor the fact that it can be overload. There is an incredible intensity to having a Zoom meeting and maybe doing 4 or 5 a day. It can be exhausting. That focus in on every little aspect of seeing yourself as well as everybody else in their state can be tough. So honor that as well. If people aren't comfortable, that's okay, but give them the preference for you to have them show their faces and be present. visually. So I'm going to turn it over to Nancy at this point, and we're going to shift gears a little bit to returning to office. We will incorporate both the returning to the office and the remote work because both are simultaneously important here to address. And with that, Nancy.
Thank you, Jill. So you can go ahead and switch to the next slide. So returning to the office is on everybody's minds now. And one of the things that we like to point out is that it is returning to the office. It's not returning to work, because everybody has been working, well, not everybody, but lots of people have been working very, very hard, though it is remote. So we are making sure that we say return to the office to make sure, again, that we're honoring the work that people have been doing through this time. So I'm sitting on a number of committees for different clients of ours where we're talking through all of the different pieces to returning to work. And I'm also helping a client who has had people working the entire time as an essential worker, and some of the things that have gone on there. So the first thing to do is to create a written site-specific worksite plan. I practice saying that 3 times because it's very hard to say. Written site-specific worksite plan. So making sure that you have a plan in place, ready to go whenever it is that you decide to go back to work. What's in that plan should be, first of all, who's responsible for implementing it, whether you have a committee, you probably have a senior leader who is sponsoring the committee. So make sure that you know who is on the committee, that you document that, and think about the different areas in your organization. I would say HR would always want to be on this committee. So if you are not, and you know that this is starting to go on, I would highly suggest you insert yourself into that committee. You do a risk assessment. Every organization is different, and that's why site-specific is so important. Some organizations have lots of clients coming in. Some don't have anybody coming in. Some have lots of vendors. Some don't have any. So really, the plan that you put in place is going to be very, very specific, and you need to look at all the different risks that you could potentially come across for your organization. So training and communication is another important part of this. You want to make sure that you have a plan for telling your employees all the different pieces that you have been doing to make sure that you are ready for them to come back. And also, of course, training them on how to reduce the spread of COVID when they're in the office. Control measures. So some are doing symptom screenings. I know there's 3 questions that SFDPH has put out that they want everybody to ask anytime somebody is coming in the office. So, but for somebody that has essential workers, you may want to be doing temperature checks, making sure that people are using sanitizer and all those kinds of things. So you want to be careful about looking at all the different areas that you want to document for the safety of your staff. So processes for compliance to make sure you're complying with all of the legal regulations, the new leave laws that have come into place, and then also correcting any kind of deficiencies that you have in your processes. There'll be lots of cleaning and disinfecting protocols, talking to your janitorial service, and figuring out ways that you can disinfect more and clean more within the bounds of your workplace. There's obviously physical distancing guidelines that you need to follow and look at. And then really important is a process for investigating if somebody does come down with COVID. If somebody comes in and you're taking temperatures and they have a temperature, what are you going to do for that? What's the process that you follow? And really, really important to have that plan ready to go so that you're not developing it right when this happens. Next. So redesigning office space and desk configurations. There's lots of different ways that you can do this. Again, really depends on how you're working. If you have everybody now working on big tables in one room, you're probably going to want to rethink that and maybe think about spreading people out a little bit, potentially putting up some kind of barriers. Although barriers don't do a ton, they will do something. But thinking through if you have offices, if you can turn conference rooms into office space potentially, there's lots of different things that you can think through on how to redo your office space and your desks.
And can I just add something here? And it's just food for thought to think about that as we as a culture have gone through various transitions over the years. We used to be a culture where we were all in the office, and then we switched to being in open cubes. And there were concerns about privacy in as sort of an outcome to that. And then we're now, right, where we've got the pandemic and maybe a new phase for this desk configuration. So you might want to think about the long term at the same time you're thinking about social distancing in terms of what might be the appropriate configuration, so you don't end up having to do that twice. At the same time, Nancy, do you want to talk a little bit about this rotation of the 4 days in?
Yep.
And maybe you're going to get to that later, and I may be jumping the gun. You are. Okay.
No, I'm going to get to it right now.
Okay.
So yes, there's a really interesting way that actually came out in the New York Times a couple weeks ago about how to bring people back in the safest way. And what they were saying was you divide the organization into two groups, A and B. Group A works in the office Monday through Thursday, and then they are working remotely on Friday and the full following week. If they're not back in till that next Monday, that means they have 10 days where they have been out of the office, 6 of those working remotely. The next week, same thing for Group B. They come in 4 days and then they work remotely for the remaining 10. What that does is it gives you time on Friday when nobody is in the office to do a deep clean. And if you have a lot of people in and out of your offices, even though you'll be cleaning throughout the week, you may want to do a very, very deep clean on that Friday. And it also gives people 10 days where they're not in the office. And that if they're going to develop symptoms, they most likely would develop it in that time period. So, and if somebody comes up, positive, and you do the testing and you see that they had a meeting, let's say, with somebody else, and they were in a room together for quite a long time, even though they were social distancing, you could talk to that person. They'd already be out. They'd already be almost what you call quarantine. So it's a really interesting way to think about how to do this if it works for your organization. It may not be what you do long term, but it certainly could be something that you do, for the next couple months. And I agree with what Jill said, that think about going forward. You may be able to only do this once, or be able to move in a direction where you make some changes now with the intent of making some changes down the road. So try to think bigger as opposed to just making the changes for the time being. So physical and safety considerations, and this again, some have lots of visitors and clients and deliveries and lots of employees, others don't. Workspaces. So I have seen a number of what they're calling clear desk policies come out, which means that everybody has to take everything home that's on their desk that's not work related, and they need to put anything that was on their desk away each night. And that way the janitorial staff can come in and just completely wipe down the entire desk. That's a big one. I actually know a company with 6,000 employees that's implementing this now. So it's not just small companies, it's also larger companies too. And it's just, again, another way to assure that you are able to keep the office clear. It's difficult to tell employees to take their, teddy bears and all kinds of things home. And we all know that all that stuff piles up in the office sometimes. But what you get out of it, the benefit, I think, is much greater than not implementing something like that. So definitely something to consider. Training your employees on how to limit the spread of COVID-19 is really, really super important. And I'll tell you why. I think you know why. But I actually worked with somebody who had put all these plans in place, And we were very clear about social distancing and, you know, staying 6 feet apart. I was wearing a mask, all these things. And then they had somebody come down with COVID-19. And when we talked with them, we found out that they were sharing cigarettes, and somebody had shared a drink with somebody else. They got into a car, 4 of them, took their masks off, went, grabbed some lunch, came back, put their mask back on. That's enough to expose somebody. And we were able to catch that, but I wouldn't have thought, honestly, that I'd have to go to that degree to say, don't share food, don't share cigarettes, don't share vape, whatever it is. I wouldn't have thought that. And so that's something that I learned in this process. And I think it's important for you to know that don't think that it's overkill when you're going down to that level in these kinds of policies, because the more that you explain and are detailed, I think the better the outcome will be for your organization. Next. Okay, social distancing. So stagger flex work schedules, which we talked about the one that that I saw in the New York Times. But there's lots of different ways that you can do that. You may have some come in the morning, some come in the afternoon. Maybe you decide you're going to have people work only 4 hours a day, whether the morning or the afternoon. And you know, and those people, when they're in, will move around so that they're not directly across from somebody. They're at least 6 feet apart. So you gotta look at your office configuration and then see what works best for you. Important to put signs up in all of your areas: break rooms, you know, kitchens, restrooms, big conference rooms. Put signage up that says no more than X number of people in this room at a time. You know, you must stay 6, 8 feet apart, whatever it is that you decide. Again, the more explicit you are with what your expectations are, the better that people will follow, and the easier it will be for them than to try to remember all of this. So put it on the door as you're going in, put a big sign in the room, whatever it is, to make sure that people understand. And that includes like restrooms. You know, you wouldn't think that, but it is important for even smaller rooms.
And I just want to add here the fear element for people. I mean, we've certainly had plenty of clients that have had employees that are concerned, and we'll talk about this more later, about going back to the office. So the more proactive you are in your planning and your explicitness, the more that avoids the fears of people when thinking about coming back to the office. Yeah,
if you haven't already been dealing with that, you will be dealing with the fear. And so the more that you communicate about all this, the better. Increasing physical space between employees. So, you know, there's this, I've heard 6 feet, I've heard 8 feet, I've heard 6 feet is okay if you're just passing by, but it should be 8 feet if you're going to be actually in a room with somebody. There's lots of different data that's out there. And so really you have to just do what's best and what works in your environment, but just making sure that that physical space is there both to your side, in front of you, and behind you. So flexible meetings, try as much as you can to cancel meetings if you don't need to have them, or have them online. Lots of different things to think about in terms of travel, and that means traveling to conferences, which I'm sure will start again in 2021, maybe even towards the end of 2020. So is this critical travel for somebody to go on? And could they do this a different way? And then travel also includes things like, how do your employees get to the office? Do they take BART? Do they take a bus? What are all the different options that they can get to work, which is important information to be able to provide to employees so that they can make the best choice that they can when coming into work. Delivering services remotely, so kind of like what we've been doing now on the phone, video, web. Are there different ways that you can do these kinds of services that your organization does? A lot of nonprofits who've seen clients have been doing much of their work on Zoom, but there are also many nonprofits who have clients who may not have access to the internet and may not be able to do that. So are there ways that they can give that access to clients in a safe way so that maybe they could come in, even if not everybody's there, but there's a place where they can go and they can get online and they can have their meeting. You can do things like that. So really think about all the different ways that you can still get people communicating, and it doesn't mean that when you come back to the office, it has to be in a room face-to-face with somebody. There's lots of other ways to do this. And then we've already all seen the curbside pickup on food and alcohol now and all kinds of things. And that's picking up in terms of the business world too. So being able to pick up other things through curbside, is a good way to do it. It does take planning. You need to figure out how they're going to notify you and all of that. But it is a safer way than having lots and lots of people coming into your organization. Okay. Oh, there we go. What if an employee does not want to return to the office? So this is a biggie. And the most important thing that you can do is just use your active listening skills, really listen to what's going on, and make sure that they understand that they are heard. A lot of their fear will hopefully be reduced when they see the plan and when they see all the different things that have been done. But most important is listening, because they may need an accommodation. You may need to allow them to work from home. There may be an ADA reasonable accommodation that you need to grant to them. You may not have known that somebody had a disability. Many, many people don't disclose to their employers that they have a disability because they can get by at work. With what's going on now, they may not feel comfortable coming in. It may be harder for them to use some of the transportation because of some disability that you didn't know about. So don't just discount people and say, sorry, everybody's back in. You've got to listen to what they have to say and understand that there may be some accommodation that you need to make for this particular individual. One of the things that I've been hearing is that if they've been working at home just fine over the past few months, and you're saying, I want you in just because we want people in, and they're coming back and asking for an accommodation, you're going to have to prove why they can't get their job done remotely. So consider that. Think about that when you're talking with employees and hearing what's going on for them. Jill talked about EAP earlier. I would highly recommend that if somebody does not want to return, that you give them the information so that they can try to talk this through with somebody. Making sure you're following all of the OSHA guidelines and that you are providing all the PPE so that people can have masks and potentially face shields, that you have all the hand sanitizer, that was my technical word for hand sanitizer. All of those things that you want to make sure you have in your organization. And then if they really just don't want to come back, you can allow them to resign and tell them that when they're ready to come back to work, if there's a position open, that they will be able to reapply for the position. Some people may not want to come back, and if there's a real reason that you need them to come back, it's okay, and you are going to lose some people. It's just going to happen, and that's okay. Next. So can I take an employee's temperature? So in the past, no, because that was a medical examination, but in times of COVID, yes, you can. It's tricky, because that you have to make sure you have good plans for doing this, right? When do people come in? Who's going to do this? Are they fully trained to do this? Are employees going to feel okay about another employee taking temperatures? Are you putting that employee at risk for being the one that's taking everybody's temperatures? There are companies that will come in and do this for you, and you schedule them for whatever, 4 hours, and they come in and they document everything. They bring in all their own equipment and they handle it for you. But it's an important thing to do if you feel that there is a risk based on your organization. And I have seen it work now very, very effectively. And the process that they put together where everybody kind of, as they come in, they go to one place, they fill out an app with those questions that I referred to earlier from SFDPH. They're on an iPad. The nurse asks them, they answer them, and then the nurse signs it. It gets sent off, and then that's all stored in their insurance file. You can do it manually as well. They take the temperature, and then they go in and they do their thing. So people, they grumble a little bit at first, but then people, it's not that big of a deal as long as you do the planning and the communicating on it. And again, ADA confidentiality requirements and making sure that everything's in the insurance file, not the employee file. Next. Exposed employees. This is something, unfortunately, that I've been dealing with most recently. And it's kind of an interesting process. And in all the years I've been in HR, I've never quite gone through anything like this. So you can't teach an old dog new tricks, as they say. And there's a lot to learn in this area because you're dealing with people now who have been exposed to, a devastating virus that nobody knows how it's going to affect them. And so you start getting a lot of anxiety. And so EAP, again, in this instance is an important thing to pass along. We can go to the next slide. So what do I do to prevent exposure? So one way, taking temperatures, as we talked about. If somebody comes to you and they have symptoms, if they appear sick, send them home. Ask them to get tested. There are lots of ways to get tested now. And one of the things that you can put in your plan is, here are the 3 different areas around where you can go get tests. So if somebody does test positive or does come to you with symptoms, you can send them right out to go out and get a test. But don't have them stay in the office. They should immediately go home if they're not feeling good. Sometimes, even if you say, employees maybe says, oh, I have a stomach ache, or, I don't know. I don't know what it is. I just don't feel good. Don't take the chance. Don't try to guess what is or isn't a symptom, because every day we hear something new about this virus. So don't take any chances. Send them home and have a plan for what you're going to do. Are you going to put them out for 3 or 4 days on sick leave? Or ask them to get tested within 24 hours to get the results back to you, but don't keep them in the office. You can increase the air exchange in your building depending on your HVAC system. I know an organization that just spent about $15,000, and this is only about a year-old system, but it upgrades the air quality coming into the building. They felt it was important to do that for their employees. So it's something that you can look into. It could be expensive, but something to think about. And especially in areas like bathrooms and small rooms where there's not a lot of ventilation, trying to understand if you can increase airflow to those areas is important. Frequency of cleaning. So some people are implementing having a day porter come in the middle of the day and cleaning. So they're shutting down for lunch. Day porter goes in and cleans all the main areas. But it's also cleaning throughout the building at other times. So depending on how many people are coming in, using the restrooms and all of that. And then, as we talked about, protocols for congregating in different areas. So to prevent, exposure, make sure that you are keeping people as distant as you can. Next. What do I do if an employee thinks they have symptoms? So the employee should report that immediately, and you need to make sure that one of your policies says, if I feel sick at all, you need to notify whoever that is. Send them home, and then require a medical release or a note or something, because if they have symptoms, even if you're not sure it's a COVID symptom, have them get tested and have them send you the results so that you know and they know that it's okay for them to come back. It's important to do that for the safety of everybody in your organization. And it's pretty easy now. You know, I know it wasn't so much at first, but it's pretty easy now to find a place, get tested, and be able to get your results. Now, that's not necessarily saying that you can go to a Kaiser or a hospital and get tested. That sometimes can take a little bit longer of a process, but there are, I think it's Project Baseline, there's a couple of different online areas where you go in, you fill in a couple questions, and then they tell you where to go. Next. So if an employee tests positive, get the medical note so that you know, get the doctor's note that says that they've tested positive. It will tell you that they need to be out for X amount of time. You're going to obviously make sure you put them on the appropriate leave. Do the contact tracing. So have questions that you've already got set up that ask all the questions about who they were with, what they were doing at work, when was the last day in the office. I have about a 2-page form that I created for a client of ours where we go through all the different areas. And actually that form was initially where we found out that people were sharing cigarettes and things like that. So ask those kinds of questions. Get as detailed as you can. I know as HR folks, we, in the past, because of HIPAA and all of this, we've been afraid to ask questions, and legally we shouldn't have asked questions. With COVID, it's different. You can ask those questions because we are trying to protect everybody in your organization. So the more information that you have, the better. And then you decide how you want to announce it. You don't have to announce it to all staff all the time. You don't want to every day announce, oh, we have a new case, we have a new case. So you need to come up with a way that you are getting this information out to the appropriate people, and then you are going to hit a wall of anxiety the first time that this happens. I know with one of our clients, we told people we had done the contact tracing. We had already notified anybody that was anywhere near this person to go home, and we self-quarantined them. But the rest of the staff freaked out, and most of them left for that shift. And you know, you can't do much about that. It's their right to do that. You obviously, you know, we don't want somebody doing that every day, or they're eventually going to have to resign. But this is a scary thing, and so being prepared for that anxiety is really, really important. And I've learned all of this the hard way because I've gone through all of this with a number of different clients. So you're hearing from someone that's made a bunch of mistakes and have kind of come up with what seems to be working well now at a lot of our clients. Next. So employee benefits, there's all different kinds of leaves that go along with COVID-19 and different ways that you can help employees to get benefits. I think the biggest thing, and you probably all know about this, is the emergency paid family and medical leave for if you have a child that you need to care for, and the emergency paid sick leave. For me, the emergency paid sick leave is what I've seen people using a lot. There was some concern that people were going to take advantage of this. You know, if you work for a couple days and then you're a new employee and then you have to give them 80 hours, it's a little rough, but I will say that I've not seen that much. People are being pretty good about this. So making sure that you're getting people out on the right leaves, making sure that you have forms for them to request the leave, that you have signatures, that you have all the information that you're going to need for payroll to be able to look at their schedules and see when they go out, how many hours, all of those kinds of things, really important to have documented up front. Workers' comp is a tricky one, and there's not a lot out about that now, but it's starting to come out. And you know, as much as I have heard people say, well, I was around so-and-so at work, so I must have contracted this from that person that was at work. We just don't know. You could have been on a bus, you could have been on the street, you could have been anywhere. I don't see how we're going to be able to prove that that somebody got it from work. And that would make it a workers' comp claim, but I don't know. We don't know how it's going pan out. So certainly be aware of that, and you might even want to reach out to your workers' compensation brokers and see if they have any information for you or some ideas on what you can do around that. I wish I had a better answer, but I don't.
Well, and also to check with your workers' comp carriers and see what how they're framing their claims in response to the pandemic and when people are getting sick and filing claims, because I'm guessing at this point there is much more that those particular workers' comp companies are deciding where they're drawing the line. So explore that with them so you better understand where those lines are.
Next. All right, back to Jill.
Okay, so in this next section, I'm going to a little bit to managing people and thinking in terms of whether people are in the office or remote, how best to manage with people in alternative locations, right? Whether they're in their home offices or in work or, hiking while they're holding a meeting, right? We are doing our work in all different kinds of locations at this point. Mostly at home, though, for sure. Let's go to the next slide. Okay, so ideally, I would argue that the most ideal way to manage your team and to respond to the changing times is to develop an agile work environment, an agile culture where you're able to respond to changing needs. Because as we reinvent ourselves or as we continue down our same path, there are going to be different responses that need to occur, whether that's in how you address your people or how you address your clients, how you address your mission-driven organization. So that responsiveness it all plays together. And so if you're thinking in terms of being an agile work environment, what does that mean for you in terms of managing? So I would argue that all management is good management, and remote management can be good management. And the most ideal structure for that is to set up a way for people to be able to communicate regularly, to know how they're doing and getting regular feedback, for managers to know how employees are doing, for employees to know how they're doing in their manager's eyes, and to be able to course correct. So these are three key components for what is considered good management. If you can set up a structure where this shifting can occur, but most important point of that is so that employees are clear. And maybe responsibilities for employees need to shift because you've had to redesign how you're supporting clients. I mean, we've been working with a few different, for example, organizations that may be delivering food or providing food, and maybe they had a location that was on site. Maybe it's maybe their market has changed, but in those changes, employees' responsibilities change. And so now if you have people working remotely out of their home office, how do you know what they're working on, right? And so accountability becomes key. I used this example the other day that I was talking to an employee at a particular company who I could tell through our conversation that she was not working very much. And I wondered to myself, does her manager know that she's not working very much? I'm guessing probably not. She's probably not offering that information. And how do you as a manager or a leader in your organization know what employees are working on, know that they're clear on what they're working on. And so creating a way to support that management is key, and maybe now it's key to be more outcome focused versus not. And so as you're setting up or thinking about maybe how you need to shift how you manage people, that outcome-based work that you're holding people accountable to needs to be measurable so that success is clear, both for you and the employee. And so I would encourage employees to maybe take their own responsibilities, maybe make a list of what those responsibilities are so that you both can see what those are, and to have that person define what success looks like. Maybe you break it out into behind, on track, and ahead, and what each one of those looks like in terms of measurable criteria. And then regroup and talk about that. And so we've talked about earlier having one-on-one conversations more often, having that connectedness. The weekly conversations are different than performance-based conversations. And so I would argue that it's important to keep those two different and separate and clear. And so weekly conversations are more tactically based about the work that's been happening that particular week, whereas performance-based is more about what am I responsible for overall? What are the obstacles that have gotten in my way? What am I not clear about? What have I succeeded on? What have I not? And then in terms of this last bullet here on culture shift, another piece of this is this creating a culture of collaboration and really bringing your team together in a meaningful way so that you're all aligned to whatever it is that you're trying to accomplish as an organization. And one way to do that is to make sure that people have goals that are aligned to initiatives that you're creating. And again, to make those measurable goals so that you are clear on what those outcomes look like, and for the employee and for the manager, and that those get aligned to the initiatives of the organization. So transparency is a strong concept in a way to succeed in working together and collaborating if everybody can see what everybody's working on. So that would be the ideal. Important to have inclusion so that, especially now, right? Diversity, equity, and inclusion are such a key hot topic, and it's not going away. And so to set up ways within your organization so you can level the playing field so everyone can succeed is going to be key. And if you can make sure that everyone in the organization is clear on those frameworks that you've set up, all the better. So I know I touched on all that fairly briefly, but hopefully it was clear. And you know, creating those kind of cultural shifts are challenging. In a normal day, they're challenging. Right now, I would argue even more challenging, but they can be done. And having tools to help support that can help make that much easier. Next slide. So you want employees to be, and this is sort of reiterating what I've already said, you want employees to be clear on their primary job responsibilities, clear on their expectations and what's ahead, even if that's going to continually change, and how their efforts contribute overall. So when you have an employee who's working remotely and is somewhat isolated and not feeling connected to people and needs that social interaction, the more you can do to create a transparent organization where they can see how they participate in a larger organization becomes powerful. And then this last bullet, the entire organization's strategy and how they fit in. So again, that reiterates what I just mentioned. Next slide. And then managers, to the opposite here, should know what their employees are thinking and feeling, how their employees are performing against expectations and the roadmap forward. Understand their employees' strengths and weaknesses and be able to really work with those. And how to be great coaches. Actually, before I talk about the coaches, let me just say in that third bullet, documentation is something Nancy and I have not talked about at this point and is very key. From everything we've talked about, documentation is important. So when you have employees that need to go out on, maybe there's a workers' comp claim, maybe there's someone needs to go out sick, maybe they have asked to not work because they think they have COVID symptoms. You need to be tracking and documenting all those conversations, all those requests, and performance conversations. So I would argue that this is a great time to have a process for documentation. And then lastly, the great coaches. So you want managers to not micromanage, but to be great coaches of their employees. And so to give them a framework to doing that is important. So again, if you can, if you have the means for engaging in a software tool that helps support some of what I've talked about and provides a framework for some of what I've talked about, that will help immensely in trying to create this cultural shift. And you want the components of that tool, ideally, to have a coaching framework, alignment to the vision, create a transparency where you can see what other people are working on, what everybody's working on towards the initiatives of the organization, regular performance conversations, and the ability to course correct. So those are your ideal components of a performance-based tool. And we've worked with quite a few, so we're happy to make recommendations. We're up against the end here. I think I've talked about many of the I've addressed many of the questions, or Nancy has. I know there were questions about that 4 to 10 day plan, Nancy, and that's in the New York Times, more information on that. There was I also heard a podcast on the Daily that talked about what that looked like. We can also help support that if you would like to reach out to us. There's a couple people who are asking about software recommendations. I can tell you one that we use internally for our team, which has a lot of these components, is called 2020 Insights. And you can see it at 2020insights.net. We are resellers of that, so we can support that if you are interested. We can provide a demo, so reach out if you'd like to see that. There's also small improvements, which comes pretty close. Doesn't have all of the components, but there's quite a few of them that are included in that. Greatly appreciate all of you attending. We wish you all the best. We're here to support you if we can. And have a good rest of the day. Thank you.
Thank you.